Assalamu alaikum friends, here is Sayyida OMAMA SHAH, and today we will be having some questions and I will give the answers of those questions with explanation, and these question answers are taken from the cardiovascular system. So let's start. So friends, let's start our question answer session. The first question is, which vessel has greater compliance? Compliance means stretchability or distensibility. Now here the question asked is, which vessel can be stretched or distend more, and that is veins. The veins can be stretched more, and due to the greater compliance of the veins are able to accumulate large amount of blood, or large volume of blood is present in veins, right? Okay, the next question is, in which vessel largest fall in pressure occurs? Now the fall in pressure will occur in that vessel which will show greater resistance. So the greater resistance is shown by the arterioles. So here the arterioles will show largest fall in pressure because of greater resistance shown by the arterioles. Here you can see is the figure electrocardiogram recording, and here the other figure is of the impulses that is transmitted from the SA node and through the whole of the heart. Now the question is, the arterial depolarization is represented by it means that it is represented by which wave, right? So here the SA node, when it is stimulated, it will depolarize the atria. Once it depolarizes the atria will then start to contract, right? So this atrial depolarization is in the electrocardiogram, it is represented by the P wave. So the P wave basically shows or indicates that the atria has been depolarized, right? Now what will happen, the SA node is stimulated and it depolarizes the atria, then the impulses are transmitted to the AV node, right? Then through the bundle of His, it depolarizes the ventricles. Now here you can see, so this is the P wave, the arterial depolarization is represented by P wave. The next question here you can see the ventricular depolarization is represented by, now as I told you that from the AV node, then through the bundle of His, the ventricles are being depolarized. Now this depolarization in the electrocardiogram, the QRS complex here shows the ventricular depolarization, right? So the atria contracts and it then pour blood into the ventricles through the atrioventricular wall, and then the ventricle depolarizes and then it will start to contract, and it will transmit it as this is right ventricle, so this will transmit this blood through the pulmonary semilunar wall, right? So here you can see the QRS complex here, this shows the ventricular depolarization, right? Okay, now our next question is, the ventricular repolarization is represented by, now once this is depolarized, the ventricle will contract and it will eject all of the blood through the semilunar wall. The left ventricle will eject its blood through through the semilunar wall into the aorta, while the right ventricle will eject its blood through the semilunar wall into the pulmonary veins, right? And okay, so once the blood is being ejected, now the ventricle will start to relax, right? As the ventricle relaxes, it will repolarizes, means the polarity will change. The inside will now become negative and the outside will become positive. Now here one other thing arises, that here the ventricle depolarizes last, so it repolarizes first, right? And here the atrium depolarizes first, so it will repolarize last, right? This is one other important mm, topic, or you may say one another important thing that has to be discussed. So okay, now we have the ventricular repolarization is represented by T wave. So as you can see, the T wave represents the ventricular repolarization. So once again I will repeat this figure, that the P wave represents the atrial depolarization, and once the atria is being depolarized, it will then contract and pour into the blood into the ventricles through the atrioventricular wall. The QRS shows in the electrocardiogram that the ventricles has been depolarized, right? While the T wave shows us that the ventricle has been repolarized. So this was basics about the electrocardiogram. So let's move on to other questions. Now the question that we are going to have is that which vessel has the largest cross-sectional area? We know about vessels, that veins, arteries, capillaries, venules. These all are the vessels that are responsible to carry the blood, to transport the blood. So in these vessels, which vessel has the greater cross-sectional area? So the answer is capillaries. The capillaries has the largest cross-sectional area. When you combine each of the capillaries, so their cross-sectional area increases. Now when their cross-sectional area increases, their velocity decreases, because we know that the velocity is directly proportional to the blood flow and inversely proportional to the cross-sectional area. So if the capillary's cross-sectional area is increased, the velocity that will of blood that will pass through the capillaries will be less, and this will enable the blood to exchange nutrient or gases within the capillary walls. The next question is that which vessel has the highest portion of blood in the cardiovascular system? So the answer is veins. The veins has the highest portion of blood in the cardiovascular system. The next question is that the blood velocity in aorta as compared to capillaries. Now we studied a few minutes previously that blood velocity depends upon two factors. One is the blood flow and the other is the cross-sectional area. If the cross-sectional area increases, so it will decrease the velocity. So we know that the capillaries has the greater cross-sectional area and velocity in that will be minimum. But here they are asking in a blood velocity in aorta. So the aorta has greater blood flow and it has lower cross-sectional area as compared to capillaries. Therefore the blood velocity in aorta will be highest. Now the other question is number that predicts whether blood flow will be laminar or turbulent. What is that number called, which shows us that whether the blood flow will be laminar or turbulent? So that is the Reynolds number, and that number predict or indicate that the blood flow will be laminar or turbulent. Here you can see the Reynolds number depends upon the velocity, density and pressure. Now if velocity of blood or density or pressure is increased, so it means that the Reynolds number will be larger, and if its viscosity is increased, so it means that Reynolds number will be lesser. Now if Reynolds number is greater, has greater value, then it will means that the blood will flow in a turbulent manner, right? But if viscosity is increased, it means that the Reynolds number will decrease and the blood flow will be laminar. So higher Reynolds number will predict the turbulent flow, and lesser Reynolds number will predict or indicate the laminar flow of blood. Okay, now we are going to discuss very much essential question, and that is the correct sequence of the cardiac cycle phases. Here you can see the 7 phases, and it has to be discussed from this figure. This is the first phase, and this is the atrial contraction. Now when the SA node is stimulated, the SA node depolarizes the atria. Once the atria is depolarized, the depolarization is shown by the P wave in the electrocardiogram, right? That depolarization causes atrial contraction, and the blood is poured into the ventricles through the atrioventricular wall. Now at the end of this atrial contraction, the atrioventricular wall will close, and now what will happen, there will be a next phase, and that will be the isovolumetric ventricular contraction, right? It is called as the isovolumic because the blood volume remains constant because of the closing, or because the both the walls, such that atrioventricular walls and the semilunar walls are closed. So no blood is entering into the ventricles, and the ventricles are starts to contract because of the depolarization of the ventricles, and that is shown by the QRS complex in the electrocardiogram, right? So that depolarization causes ventricular contraction. Now if when the pressure in the ventricle exceed in that of the aorta and the pulmonary arteries, what will happen, the semilunar walls will open and the blood will be ejected into the aorta and the pulmonary arteries, right? This ejection is further divided into 2 phases. First there will be a rapid ejection, and then it will be slow ejection. Now once the blood is ejected into the aorta and pulmonary arteries, what will happen, again the ventricles will start to relax, and the both the walls, such that atrioventricular walls are closed and the semilunar wall will be closed, alright, and the ventricles will start to relax. Now here again there is the blood volume is remain constant, right, because no blood is entering into the ventricle, therefore, and the ventricles are going to relax, therefore this phase is called as the isovolumetric relaxation. Now once the ventricles are relaxed, what will happen, the AV walls will open, right, and the blood that was in the atrium coming from the lungs through passive filling, it will then pour into the left ventricle through the mitral wall, right? Now first the flow will be rapid from the atria into the ventricles, and that will produce third sound, right? Third sound will be produced when there is a rapid inflow of blood from the atria into the ventricles, right, through the mitral wall or the bicuspid wall or the tricuspid wall, right? Okay, now first there will be rapid flow, and then there will be a slow filling of the ventricles. That slow filling of the ventricles is called as the diastasis. This diastasis is the final phase of the cardiac cycle, and here the cycle again proceed like this, right? Okay, so now coming to the next question, and that is A wave represents. Here you can see the A wave, and it is also represented over here. This is the A wave. So the A wave basically represents the increase in venous pressure by atrial contraction. Now when the atria contracts, the blood is poured into the ventricles, right? So when the blood is poured into the ventricles, it increases the ventricular pressure. So that increase in the ventricular pressure due to the contraction of the atria is represented by the E wave. Now the second is the C wave represents. So the C wave, bulging of mitral valve leaflets bake into the left atrium. Now when the atrial contracts, the mitral wall will now closed. This closing of mitral wall or bulging of the leaflet back into the left atrium is represented by the C wave. Now we have a V wave represents. the passive filling before the opening of the mitral wall, right? Here it is during isovolumetric relaxation, the AV wall here is closed, and the blood is coming from the lungs into the left ventricle passively, right? So this passive filling of the left atrium before the opening of the mitral wall is represented by the V wave. So it was all about, and this is the basic concept in the cardiovascular system. Now the question is, cardiac output is determined by. Now what is cardiac output? Cardiac output is basically the volume of blood pumped by the heart in a 1 minute, right? So it is determined by the stroke volume, which is the volume of blood pumped by the ventricle in a single cardiac cycle, right? Now in human beings, the duration of cardiac cycle is, it is 0.8 seconds, 0.3 is of systole, and 0.5 is of diastole. The other question is, in 1 minute the volume of blood pumped by each ventricle. Now in 1 minute the volume of blood pumped by the heart, or you may say by ventricle, is called as the cardiac output, and we know that the cardiac output is equal to the beats per minute multiplied by stroke volume, right? So if you take for your easier calculation 70 beats per minute multiplied by 70 milliliter, which may be stroke volume, then it comes approximately 49,000. So it is equal to the 5,000 milliliter, you can say. Okay, now we have there are two distinct heart sound in the cardiac cycle. One is lub and the second one is dub. Now you have to tell that which one is the first sound. So the first sound is lub, and the lub is then followed by the dub. Now coming to our next question, the first sound is produced by heart during closure of AV wall. Atrioventricular wall closure produces first sound. The second sound is produced by heart during closure of semilunar walls. The closure of semilunar walls produces second sound. Third sound is produced by the heart during rapid filling of ventricles, such that when the blood is coming from the atrium directly into the ventricles through the atrioventricular walls, this is called as the rapid filling of ventricles, and this rapid filling of ventricle produces third sound. In infants or in childs it is normal, but in adults it shows some defects in the heart. The fourth sound is produced by heart during atrial contraction. So when the atria contracts and pour blood from the atrium into the ventricles, because of the depolarization of the atria, it produces fourth sound. So in short, atrial contraction produces fourth sound of heart in the cardiac cycle. Now coming to our next question, and that is the permeability of capillary pore to that of water and albumin. So the water is more permeable as compared to albumin, as you can see it from the given values. The second question is, which system is used in long-term blood pressure regulation by adjustment of blood volume? So it is basically the RAAS system, renin angiotensinogen aldosterone system. It is responsible for regulating the blood pressure when the blood pressure is changed because of the blood volume. So I'm going to explain this RAAS system from this figure. What will happen if the blood volume is decreased? It will be detected by the kidney. The kidney will in turn excrete renin from the juxtaglomerular cells that are present in the afferent arterioles. This renin will catalyze the angiotensinogen into angiotensin 1, which is its inactive form, the angiotensin 1 will be converted into angiotensin 2, that is its active form, by the ACE, such that angiotensin converting enzyme from the lungs, this reaction will occur in the lungs. Now what the angiotensin 2 will do, it will stimulate the pituitary gland to release vasopressin, the adrenal cortex to release aldosterone, and it will constrict the vessels. By constricting the vessels, it will increase the total peripheral resistance, it will do the vasoconstriction and increase the resistance. The resistance will increase the blood pressure. Now vasopressin, the vasopressin also called as the antidiuretic hormone, it is also a vasoconstrictor. It will absorb the water from the renal tubules, and by increasing the blood volume, it will in turn increase the blood volume by absorbing the water from the renal tubules. Okay, now what the aldosterone will do, the aldosterone will absorb the salt from the renal tubules, right? And thus it will also in turn increase the blood volume. So by increasing the blood volume and the total peripheral resistance, the blood pressure will rise. The other question, that is, what is function of ACE inhibitor? So lower the blood pressure by blocking the production of angiotensin 2. We studied here that the angiotensin 2 increases the blood pressure. So by inhibiting the ACE enzyme, angiotensin converting enzyme, this enzyme will then not will unable to convert the angiotensin 1 into its active form, and the blood pressure will not be increased, and the ACE inhibitor will in turn decrease the blood pressure. So the blood pressure is decreased by the ACE inhibitor, and it do it by blocking the production of angiotensin 2 by acting on the ACE enzyme. So this was all about RAAS system. Now the next question that we have is, here you can see these are the characteristics of a specific compound. You have to identify which compound is that. That compound is released in response to the increase in arterial pressure from the atria. When it is released in response to an increase in arterial pressure, it will now tend to decrease the arterial pressure. How? By dilating the arterioles, by decreasing the total peripheral resistance. It will increase the excretion of salt and water by the kidney, and it will inhibit renin, as because renin is released in response to low arterial pressure, and the renin increases the arterial pressure. Therefore it will inhibit the renin release from the kidney. So these are the characteristic of which compound. The compound is ANP, atrial natriuretic peptide. So the atrial natriuretic peptide is released in response to high arterial pressure. It dilates the arterioles, it decreases the total peripheral resistance, inhibits the renin, and increases the excretion of salt and water by the kidney. The next question that we have is a condition in which tissue damages. Here it is a condition in which tissue damages. And why? Because there is less supply of O2 and nutrients. And why? Because the blood flow, you may say the blood volume is low, the blood flow to that tissue is low. So if the blood volume or the blood flow to a specific type of tissue is decreased, what it will do, it will damages the tissue. So the damages of the tissue because of the inadequate O2 and nutrient supply, and the O2 and nutrient supply deficiency is because of the decreased blood flow. The condition is called as the circulatory shock. So the circulatory shock is a condition in which tissue damages because of inadequate O2 and nutrient supply due to generalized or decreased blood flow throughout the body. And there are different types of circulatory shock, but because the video is going to get lengthy too much, so We will discuss that later in some other video. So friends, thanks for watching and Allah Hafiz for now.